And welcome back to Talk of Alabama. Today we are chatting about advances in knee replacement technology. We've got Dr. Jeffrey Davis here from Andrew Sports Medicine and Orthopedic Center here with all of the details. So first, welcome to you.
Thank you very much.
I'm glad you're here this Halloween Eve. Yes. What are some really, I guess, for all of us thinking about this, physical conditions that may tell you you need a knee replacement?
Well, obviously, the things that we look for, pain is the primary indication.
Okay.
But you have to make sure that the pain is originating from the knee.
Okay.
The most common things we see are arthritis, just wear and tear arthritis, osteoarthritis, rheumatoid arthritis, degenerative arthritis. We also see trauma that's becoming more common, especially in our athletes that get injured when they're young people, that later on, after they've had surgery on their knee. As you've experienced many times, as you get older, the arthritis begins to show up and becomes more painful, more problematic, and those are the kind of things that we look for replacement.
So if somebody's watching at home, if they have any of those ailments, that would obviously make them a good candidate. What are any other primary reasons that you'd recommend somebody have this surgery?
Well, I think what we look for is what are the purposes you're looking for? What are you trying to gain from the surgery? What are the reasons you're seeking care for the particular problem you're looking at? So I think that certainly pain is the most common indication, and that can be caused by many things, as we talked about. But there's also sometimes stiffness or deformity or lack of movement, motion, instability, looseness in the knee. But the surgery, especially knee replacement surgery, is usually the last step. You know, you want to do conservative things first. You go through physical therapy, bracing, medications, injections.
What about the advances? Because you brought this knee with you over here that we're looking at on the table. The advances in technology and medical procedure.
Well, I think that there's not been a lot of new advances in the equipment that we use, in the technology of the equipment that we use, but the techniques have improved, the surgical techniques and the way that we do the surgery. One of the ways that it's improved is a process that we call Visionaire, and what that does is the patient gets a MRI of the knee prior to the surgery, and we make specific cutting blocks for the knee.
And what are we looking at here, by the way?
That's somebody getting an MRI of the knee, which then is utilized to form these cutting blocks. They also get a long-standing X-ray of the knee to make sure that the alignment is appropriate.
That's interesting. So back on this demo, this is the actual knee joint itself, and this is the device?
This is the device that's created for that specific patient. And so what we do is we put this on during surgery, and then we make our cuts through here, and that begins the process of making the cuts for the knee replacement. So that gets us in the right alignment, and so it's predetermined, the size and the alignment. So it helps us be more accurate during surgery.
Okay, if people want more information, because we don't have enough time to talk about everything we need to talk about, how do they get a hold of you?
We're at Andrew Sports Medicine here in Birmingham, andrewsportsmedicine.com. Telephone number 205-939-3699, and we'd be glad to talk to you further about this.
Okay, andrewsportsmedicine.com, the experts in knee replacement. If you are having any issues with your knees, this is the place to go. Thank you so much for being here.
Absolutely.
We
Thank
appreciate
you.